So you were at a medical school. Oh, who's this? How are you? Happy birthday. Happy birthday. Happy birthday. How are you? Come on. We had a great tour of the medical center just now, and one of the most promising things I saw were the technological innovations here that are cutting the costs of healthcare and improving its quality. For 8 consecutive years, OSU has been recognized as one of America's most wired hospitals because it's been a leader in the use of information technology in patient care and research. And this must be the future of healthcare in America, not just because every patient deserves the best care possible, but because they deserve the most affordable care possible. And bringing our healthcare system into the 21st century is one of the best ways to do that.
Diabetes is a moving target because their pancreatic function's decreasing over time, so their drugs do change. If they're on pills alone, each pill's about $1,300 a year. You have to imagine it's not only their diabetes drug they're also on a cholesterol-lowering drug, an antihypertensive drug. They might be on something to help with weight reduction, as well as some other entities.
So cumulatively, it might be as much as $250, $300 a month?
A little bit higher, because they usually walk out of our office on 5 drugs.
So $400 or $500 a month?
We now spend over $2 trillion on medical care every single year. It would be one thing if all this money went directly towards making us healthier and improving the quality of care, but it does not. 1 out of every $4 we spend on healthcare is swallowed up by administrative costs, on needless paperwork and antiquated record keeping that belongs in the last century. We also spend far too much on treating illnesses and conditions that could have been prevented or managed for far less. Our healthcare system is turning into a disease care system where too many plans and providers don't offer or encourage checkups and tests and screenings that could save thousands of lives and billions of dollars down the road.
We have a pretty aggressive group in financial services that will reach out to patients if they are eligible and actually help them get enrolled in Medicaid if they are not. Currently in University Hospital, our self-pay rate, which is what we call for folks that don't have insurance, is about 10%, but that takes into account medical and surgical both. Given that most people don't even schedule surgery if they don't have insurance on the medical side, it varies between probably 15 and some services almost up to 20% of the patients.
And of course, the biggest obstacle in the way of reforming this system are those who profit most from the status quo. The drug and the insurance companies, in some cases the HMOs, who pocket an enormous chunk of the skyrocketing medical bills that working families are struggling to pay. I have heard these stories day after day over the last year of this campaign. The same stories are happening right here in Ohio. Family premiums have risen more than 40% over the last 8 years, and the number of uninsured now stands at around 1.2 million people. That is unacceptable, and we can't afford to let these costs keep going up year after year after year. We can't afford to keep talking about healthcare reform in every election and then fail to act when we go back to Washington. We can't afford to let the drug and the insurance lobbyists stand in our way or have the same partisan bickering stop us from getting this done. Not this time and not this year.
There's no doubt that the more we can create community-based, school-based, neighborhood-based efforts that not only help screening but also help on the prevention side, that's something we have to do because, frankly, we're not going to be able to afford this. And financially, it's breaking down.
When I got to the Illinois State Senate over a decade ago, I brought Democrats and Republicans together to expand health care coverage to another 150,000 children and parents. I passed a bill cracking down on hospital price gouging of uninsured patients and helped expand coverage for routine mammograms for women on Medicaid. And we also created hospital report cards so that every consumer could see things like the ratio of nurses to patients, the number of annual medical errors, and the quality of care they could expect at each hospital. In this campaign, I've put forth a universal health care plan that will cut costs and guarantee coverage to every American. Under this plan, if you're uninsured, you'll be able to get the same kind of health insurance that I have as a member of Congress. We'll stop the insurance companies from discriminating against any American just because they're sick or have pre-existing conditions, because those are the Americans who need help the most. and we will lower premiums for the typical family by $2,500 a year. We will cut these costs in part by requiring that our public plan includes evidence-based preventive care so that we're not treating illnesses or conditions in the emergency room that could have been caught with a checkup or managed with the right care. And we'll also reduce waste and inefficiency by instituting new technologies like you've done right here at OSU Medical Center and moving from paper records to electronic medical records. This is a reform that will reduce deadly medical errors, shorten the length of hospital stays, ensure that nurses can spend less time on paperwork and more time with patients, and save billions and billions of dollars in the process. Now, any of you who've been watching the 19 debates that we've had so far can attest, both Senator Clinton and I have put forward health care plans, and they're very similar. In fact, we share the goal of universal health care. The main difference between us is that Senator Clinton includes a mandate, which means she'd have the government force you to buy health insurance, and she said that she'd consider going after your wages if you don't. I disagree with that approach. I believe that the reason Americans don't have health care is not because no one's forced them to buy it, but because no one's made it affordable. And that's why my plan does more to cut costs than any other that's been offered in this race.